Let's get to it.
Okay, we're going to review the process for creating custom orthotics. The first step is to take an impression of the foot. In our office, we like to use foam boxes, as you're seeing here. What we're really trying to do is capture the foot in a neutral position. In this case, we're looking for a straight neutral. There are some people, a lot of people, who have very flat feet, and in those instances, we'll push, as he's doing right here, we'll push down on the big toe joint and accentuate the medial arch so that the arch is as high as it would have been had the person been born with a normal shaped foot. For most people, we're trying to just create a natural neutral position. I love these foam boxes because I can get a very clean, simple impression of the foot. It's critical when you take the mold that the person be sitting. If you step right in the box and put full weight on it, like some ready-made custom orthotic companies do, the foot is going to pronate as much as it wants to, and you may not be happy with the outcome of the orthotic. It may not accomplish anything if you're trying to correct for a flatter foot or a collapsing arch. The way we do it is the patient is sitting, we put a little bit of pressure on the knee and create a semi-weight-bearing position. It captures the flattening of the plantar foot, the fat pad on the bottom of the foot, but it doesn't overcorrect, and we can correct it as much as we want, whether we're trying to supinate, create a high arch, or pronate, create a low arch. We're really in control. Dr. Lowe and Dr. Stoker taught us how to do this, and when I first bought their practice, and it served us very well. The orthotics are quite comfortable compared to previous methods that we used to use. You'll see here I'm cutting out polypropylene sheets. Comes in these little sheets. I love polypropylene. There's a little bit of flex to it. It allows for some give as you're walking, a little shock absorption, but it's still strong enough to hold the foot in the position we're going for. Looks like I need to do a little weight loss routine here. This is not a very flattering angle. So we put it in an oven. We cook it as hot as we can get it. I think it's about 400 degrees. Over a few minutes, it really softens up. I think we're the last guys on earth to do this ourselves, but we like working with our hands. We like controlling the outcome of the orthotic. We hate having a 2-week turnaround mail-in process where most labs take a while to make them. So we like doing everything ourselves. It saves us money and the patient money. So this is a vacuum press. Once the polypropylene is hot enough, it can be molded. This vacuum presses the polypropylene on the plaster mold that has been made from that foam box impression. Once this has been sped up quite a bit, but once it cools off in the mold, you can release the vacuum, and you've got the impression of the foot, the contour of the foot captured very well. There's a few steps that we've skipped here. Making the plaster molds not that hard, but there's a certain formula of plaster that you have to do. It's kind of like pancake batter, basically. Once you get it made and the mold, the foam mold filled up and hardened, our medical assistants will smooth off any rough edges or bubbles and get it to this point so that we're ready to go. Our portion as physicians only takes about 20 minutes at most, but I find it enjoyable. I like working with my hands, and I love to see how these are made and be able to understand what steps need to be corrected so that the patient is comfortable. I think sometimes you mail things out to labs, you get a final product, and you have no idea why it's shaped the way it is or what they did or what they changed, what they corrected, and it's hard to explain to the patient why something's not working. The other thing is we can correct these orthotics right in the office. If there's something we don't like about it, I can take another foam impression and crank out an orthotic within a day. The process of pressing the orthotic is done. You have a kind of a rough orthotic. There's a lot of edges on there that need to be smoothed off and ground down. This is the other reason I like to make them myself, because I can control how deep the orthotic is. A lot of my Patients who are in the pediatric range need a really deep heel cup for calcaneal apophysitis or Seaver's disease, and I can control how deep that is. If it turns out it's too big for the shoe or the cleat, while the patient's sitting in the exam chair, I can run over to the shop, make modifications right on the spot, and it solves a lot of problems. We can fine-tune the orthotic right off the bat, and it makes for a better product, I feel. Here's a demonstration of what an orthotic can do, in this case controlling pronation. You can see that it straightens up the heel bone so the foot is in a neutral position and not functioning at the totally pronated position, which is often what we're after for a lot of people with fallen arches or lower medial arches. Here's a picture of finished orthotics. You see that we can add padding. It can be short or full length. We can add posting. That's the part around the heel that looks like it's squared off that keeps the orthotic from rocking. But these modifications can be made on the spot in our clinic anyway. We can add thick or thin foam. We can add posting. We can remove it. We can heat the orthotic up and create a more aggressive arch, or wedge the entire arch into an inverted or everted position depending on the needs of the patient. An orthotic is a simple device. Usually it's hard plastic. You can cover this with as much cushion as you want, but the orthotic itself needs to be strong. If it doesn't hold the arch up and strengthen it or support the weight of the arch, you're not going to accomplish very much. I see a lot of cheap Dr. Scholl's type orthotics. They don't do much for the foot except for pad the thing, and that's okay if that's what you're looking for is padding. But if we're trying to support the arch, take away the stress throughout the plantar fascia, you need a stronger orthotic. The cheapest over-the-counter, highest quality one I've found is Powerstep. This is a Powerstep. They have different models. The one you're looking for is the ProTech Control. It's got a little blue dot at the heel, a little extra padding. The reason this one's so great is it's got what's called a post. It's a squared off bit of material on the heel. When you place that in a shoe, it keeps it from rocking. It stabilizes the foot. This one's great. It holds up pretty well. It's fairly strong, and it's got a nice layer of padding. If I had to hand pick an over-the-counter one, I'd go for the Powerstep. Super feet are pretty good. Beyond that, I'd have to see, but those are some of my favorites. The problem with these is you can't modify them very well. So if you have an arch shape that's very odd, really flat foot or a high arch, these aren't going to fit you very well, and they may not be comfortable. Good place to start. I often tell people, let's try these as a test run, see if you like the concept of pressure on the arch. If you can tolerate the pressure, great. These are only going to last 6 months to a year at most. If you're a heavy walker, if you're a little overweight and you do a lot of walking, these aren't going to last very long. But if they work well and you feel like your pain responds well to it, then a custom orthotic is the next step. We use a polypropylene orthotic in my office. Again, this is just the bare shell of the orthotic. We often add a post to this. We often add padding. This version, however, is indestructible. I've seen these last 50 years they were made by Dr. Lowe, my predecessor, and they're amazing. They never wear out. We take a mold of these in a foam box. We take an impression of your foot. It should fit you like a glove. So when you're walking, there's no moment of impact, right? It's right with your foot. So even though they're hard, they're actually quite comfortable. I'm wearing some right now. They feel great. I forget they're even in my shoes. So they're not for everyone. Some people have really tender feet and they don't like the idea of a hard orthotic. But if we can get you comfortable in them, they last forever. This version I can get in anything, soccer cleats, golf shoes, you name it, even biking, road biking shoes, which are very narrow and small. I've even got these in ski boots, climbing shoes, you name it. We can make it work, and they work quite well. So orthotics, very important. Your best bet for long-term prevention of further attacks of the plantar fasciitis is a good shoe and an orthotic. I cannot overemphasize that enough. I have so many people come in and say, you know, doc, I was feeling great. It'd been a year or two since I'd had an episode until I went to Disneyland. We went to the beach, ran around for 3 days in bare feet, and now my pain's back. Classic story. Or they were doing great with shoes and orthotics, and now they're worn out. Now the shoes are super flexible. The orthotics has become super flexible, and it's not doing anything for them, and their pain comes back. So keep that in mind. Please remember that we are doing these lectures for Operation Underground Railroad. These guys are an amazing group of people that go around the world freeing children from sex trafficking situations. There are rings of people, groups of people who take children, they farm them out for prostitution. It's a horrible thing that happens out there, but it's very real. Look up O.U.R. Rescue, OURrescue.org. Tim Ballard started this group. They do amazing work. I think to date they've saved 4,000 children from these horrible situations. They provide aftercare, placement, adoption, whatever it takes to get them in better situations. We are doing these lectures to raise money for them. So if you can, make a donation at OURrescue.org. Your donation can make a huge difference. That's why we're doing this. So keep that in mind and have a great day.